Hi, this is Paul Kolodzik. I'm the Medical Director of Integrated Wellness Solutions, and as you know, your company is putting in a wellness program for employees for the upcoming year. I'm here to explain that program. Let's get started. This presentation has been created specifically for data label and MPI label employees. That's me on the left, and I'll be serving as your medical director over the course of the annual program. Ashley Grube is your account manager. I'm going to provide you some contact information for Ashley, but she will help you in any way she can, both in understanding the program and completing the program successfully. So that's key information for you to have. That is Ashley's name, phone number, and email address, because if you have any issues or concerns related to the program or need help in any way throughout the program, please get a hold of Ashley. A little bit more about IWS. Integrated Wellness Solutions is a corporate wellness services provider. And as I mentioned, we're based in Ohio, but we're serving clients throughout the United States. We currently have about 20,000 employees on this wellness platform. And I mention that because I want you to know that we've had some experience in providing these programs, and that should translate into a good experience for you. As you might have noticed on the previous slide, I'm a physician. I'm an emergency physician, in fact, and I joined IWS about 4 years ago, really based on my experience in the emergency department. For years and years, I've been seeing patients come through the door of the emergency department, and sometimes they have symptoms that result in a concern, and those concerns just need to be addressed and they need to be reassured. But sometimes they have a real problem, a heart attack, a stroke, a complication of diabetes, or some other problems. And sometimes we can intervene in those problems, but sometimes we can't. And the damage is done and it's irreversible, and it can be a catastrophic, a life-changing event for that individuals. That's why we're focused with these programs on preventative care and getting out in front of these problems and the behavioral issues before they become a real problem for individuals. Why do companies put wellness programs in place? Or more specifically, why is your company putting a wellness program in place? Well, first of all, fully 70% of companies with more than 100 employees have these programs in place. I believe an overriding reason for a wellness program is to help protect the insurance plan. You'll hear me use that term a few times during the course of this presentation, and that is protect the plan. Your companies are self-insured companies. That means every year leadership, along with the insurance companies and the insurance broker, decide how much money needs to be put aside to pay claims. Now, if you have a medical need, if you have a condition, or you need a procedure, that's what insurance is for. But what we really want to do is protect the plan, that is, protect those resources against the increasing healthcare cost pressures that are occurring. And whether it be demographics, us baby boomers getting older and needing new hips and stents in our hearts, or other procedures, or whether it's simply that there is an increase in cost related to technology, or maybe healthcare reform is contributing some. I think there's going to be a physician shortage that maybe is going to contribute some to these increasing healthcare cost pressures. Whatever the reason, what we want to do is manage that resource, manage those monies associated with the health insurance plan so that we can control your deductibles and premium contributions and co-pays going into the future. You manage your other organizational resources, you manage your materials costs and your facilities costs. Let's also manage these resources to protect the plan long term. You should also look at this program as an additional benefit to you at no cost. This year you're going to get biometric screening services, which we're going to talk about. You're going to receive the opportunity to participate in courses, the opportunity to participate in personalized health coaching. This is really an added benefit to your benefit plan this year at no cost to you. So let's use it. All right, let's talk about a few of the specifics of the program. Those eligible for the program are employees on the Anthem Health Insurance Plan, or those that may come on the Anthem Health Insurance Plan during 2015. Spouses or dependents are not included in this program. It's only employees on the plan or who may come onto the health insurance plan. The purpose of this introduction today really is for me to give you information you need to successfully complete the program, and then also explain the incentive process. This is a voluntary program, but there's a significant incentive associated with it, and we'll review that in detail. Participation in this program and successful completion of this program really is a choice. The bar is set for each of the parameters so that anybody can achieve them. It doesn't matter if you're overweight, have a high cholesterol level, high blood pressure, have never worked out, it doesn't matter. You can still engage in this program and complete it successfully and obtain the incentive that's at stake associated with the program. All participants reviewing and listening to this webinar should have in their hands a program handout. The first page of that handout is the program template. In the box at the top, there's an explanation of the program periods and also of the incentive. The middle components are the actual program itself, and we're going to go through these line item by line item, so we're certain that you understand them at the completion of this webinar. The bottom portion restates the incentive, and then also provides that important contact information related to Ashley that I mentioned. Finally, there's information at the bottom related to alternative approaches. This program really is constructed so that anybody can complete it successfully, but if you feel there's a component that's difficult for you, contact Ashley and we can look at alternative mechanisms for you to complete the program successfully. As mentioned and explained in the template, there are two premium incentive periods. These are overlapping periods. The first period begins now and goes through February 28th, 2015, and then the second period also begins now and goes through November 30th, 2015. We're going to review the program requirements for each of those periods so you can be successful in obtaining these incentive. All right, let's look at the incentives and the incentive periods. The first incentive period is between now and February 28th, 2015. That's about a 3.5 month period of time. During that time, we're going to ask you to complete two items. The first is biometric screening. You can have that completed in your physician's office, or you can use our partner LabCorp. LabCorp has over 1,500 offices around the country, so there should be one close to you that would allow you to then complete this component successfully. We're also going to ask you to do the Anthem Online Health Risk Assessment. This is about a 25-minute survey where you answer questions completely confidential and you're given an assessment of your health risk and possible interventions. We're going to ask you to complete those two items prior to February 28th. Now, usually every year in January you have a premium increase for your health insurance premium contribution. This year there's going to be no premium contribution increase in January 2015. And in fact, if you complete the two items we discussed, the biometric screening and the online health risk assessment, by February 28th, then you'll have no increase in your health insurance premium contribution for the remainder of the 2015 plan year. However, if you choose not to complete those items, you will begin to pay about $50 more per month beginning in March 2015 for your premium contribution, and that will continue until the end of the year. All right, let's look at the second incentive period. The second incentive period also starts immediately and it runs through November 30th, 2015. If you are successful with the program during that time, you'll receive the wellness rate, the best rate available within the company for the 2016 health insurance plan year. Your contribution will be that best rate. Now, it may come to mind for you to think, well, what is that best rate going to be? Unfortunately, we don't know that at this time because that rate will be set on the healthcare cost experience during 2015. This is part of us all being in the same boat together in terms of controlling costs when appropriate. Again, if you need a service or a procedure, then that's what insurance is for. But if we can manage that cost through prevention long term and give you a very attractive rate, that's really what we all want to do. Now, if you do not achieve 250 program points during that period of time, then you'll pay an increased rate, and that rate will be approximately $50 more per month again in premium contribution during the 2016 plan year. So as an overview, again, there's 2 program periods, now to the end of February 2015, and then your rate will be set for the remainder of the 2015 health insurance plan year based on your completion of those 2 items. And then the second incentive period is between now and November 30th. And if you obtain 250 out of available 400 points, then you'll receive the best rate that's available during the 2016 plan year. All right, let's return to the handout. The first page is the template page, which you've seen, and we're going to come back to this and go through this line item by line item. But first, let's go through the other handouts. You should have 2 more pages that have been copied front to back. All right. The first of those 4 pages is labeled 2014-2015 Wellness Program Summary at the top. And then about 2/3 of the way down the page, you'll see another title, 2014-2015 Wellness Program Guidelines. Going back up to the top, what you see there is Ashley's contact information. Please use this if you need any help at any time throughout the program year. The program period is restated there, and eligibility is restated there. Again, it's any employee that's on the health insurance plan or may come on to the health insurance plan during 2015. I've restated the premium incentive information as well. Really what the remainder of these pages are is a summary for you. It's a reference for you. If you're thinking about, oh, what did he say during that webinar, or what do I need to do regarding this, then you have that information available in this handout. So you really have 2 sources of information. You can look at the handout or you can call Ashley. The next item down, the 4th bullet, is the IWS website login. Now, out of necessity, we have to have you get onto the computer, onto our website using a computer. We understand that we run across people periodically that don't use a computer regularly. The answer is call Ashley. Call Ashley and she will walk you through the whole process of signing up on the website and making sure you get your points entered appropriately. You will need your company login code. That is there on the middle of the page, the the second bullet under IWS website login. You'll see it's manifested there as X's because different companies have different login codes, so you will need that information as well. Then you drop down to the 2014-2015 Wellness Program Guidelines. The other component that needs to be done on the computer is the Anthem Online Health Assessment. This is an Anthem tool. You'll need to log on to the Anthem website, use the group identification number, which is listed there, and then complete that 20 or 25-minute online survey. Again, this is confidential, done confidentially. Information is not shared with anybody. Aggregate information, not personally identifiable information related to you, but aggregate information is shared with IWS. To obtain credit for the health risk assessment, which is one of those 2 components you need to complete between now and the end of February, you need to take the last page of that health risk assessment and fax it to IWS. Now, the remainder of this page, biometric screening, and the back of that page, which lists all the different program components, is again simply a reference for you. We're going to go ahead and come back to these as we go through the template and explain each one fully. I did not include this in your handout, but I wanted you to see what the website looks like. Once you register on the website, you will go to the Wellness Profile Dashboard page. That is this page. Whenever you enter points, you'll click on the large red button right in the middle. This website is not meant to be everything for everybody. It really is just meant to be a mechanism for you to track your progress. Of course, we have links to the American Diabetic Association and American Heart Association if you're looking for information, but we really want you to use this website just as a tool to complete the program successfully. We'll tabulate your points on a monthly basis. You can send an email to Ashley down in the lower right hand corner if you have a question for her or if you need her help. You can access all the programs and courses that we're going to be providing. We will be providing a weight management course and a tobacco cessation course. We provide registered dietary consults with registered dietitians, and we do some partial meal planning for you. We can set up exercise programs for you. If you need an extra fax form, you can access that here. Basically, this is everything you need on this page to complete the program successfully. The next page is the IWS fax form, and this is the form that we use to make sure you get credit for certain program components you've completed. The top is just demographics, so we can identify you accurately and make sure you get credit. The next items are measurement values and lipid profile. Now, if you choose to have these done through your primary care doctor, that is a preventative exam, and it should be at no cost to you. We're going to talk about that in a little bit more detail later on when we talk about preventative exams. But what we asked your physician's office to do is complete the items under measurement values and lipid profile, sign it, and then that'll be faxed to us either through the office or you can fax it to us directly yourself. If you go to LabCorp, many LabCorp locations do not do blood pressure readings or height and weight. So we'll need you to report that on the honor system, or if you can go through your physician's office and they'll go ahead and give us that information, that's fine. You can get your lipid profile work done through the LabCorp office and they will provide us that information directly. The rest of this form is important only for selective items, and for your program, those items are physical examination, PSA, mammography, and pap smear, which we will go over. You can ignore vision, dental exams, and flu shots. You can ignore that medication component. We do have programs, of course, that are a lot more rigorous than this, and I'm going to take a moment just to point that out. We have programs that are not 250 points, are 350 points, and we have programs where the incentive is much higher than $50 a month, and we have programs where there are not 7 components, there are 14 components. We have programs where the spouses are asked to be included in the program, and not just the individual employee that is on the health insurance plan. So your program in the first year is very much a kinder, gentler program. We purposely wanted to set the bar at a level where everybody would want to engage and be successful with the program. But back to the fax form again, you need to complete only those items that are pertinent to your program, that is, those items that are on the template. The next slide is Ashley's account representative flyer. Ashley serves not only as your account representative, but also as the lead health coach for your company. If you have any questions about our weight management course, stress management course, or tobacco cessation course, you can be in touch with Ashley. If you would like personalized health coaching, that can be provided. If you would like fitness planning, that also will be provided through Ashley. Finally, Ashley can put you in touch with our registered dietitians who will do an evaluation of your dietary habits and also provide some meal planning for you. Please contact Ashley, as I mentioned before, if you have any questions about the program. I've put the final 2 items of the handout on the same slide. The first is the non-tobacco user agreement. This is the agreement that's signed to indicate that you are not a tobacco user. And by tobacco, we mean smoking, smokeless tobacco, or the use of e-cigarettes. If you can sign that affidavit, then that's great. You'll get those points. If you cannot sign that affidavit, you can still get those points by completing our tobacco cessation course. So technically, you can continue to smoke, complete the course, and still get the points. That, of course, is not the outcome we're looking for. If you have any questions about the tobacco cessation program, again, be in touch with Ashley. Both these forms will be available through your Human Resources Department, but again, you can also contact Ashley either through the website or directly to get a copy of these forms. The other form that is presented here is the LabCorp form. When you complete this form and then fax it to Ashley, she will assist you in coordinating your visit to LabCorp so you can get your biometric screening done. Looking at the program as a whole, again, we're going to ask you to obtain 250 out of a total of 400 available points. Now, the purpose of this program is to provide you a little bit of structure in addressing your health habits. You know, you put me out on Canyon Ranch, and I have all day long to do nothing but work out and get in shape, and a shot of $250,000 and a couple personal trainers to support me, and a nutritionist and a chef, then I can do pretty well. But you put me back in my real life with work and running kids around and duties at home, and it gets more difficult. I need a little structure, and that's what this program is meant to provide. Now, I will tell you from my experience what happens with these programs is a majority of people look at this, say, I can do that, and they complete the program. However, a few don't. They hesitate or procrastinate. They don't care about their health, or they may not care about their money, the money involved, a limited number of people. But there's some occasionally that are just upset that now their employer is asking them to do a wellness program as well. People are entitled to that opinion, I understand, but I think the greater goal really is supporting the health of those individuals that want to participate in the program and protecting the health insurance plan long term. You have a very strong health insurance plan. You have about an 80-20 plan, which means the employer contributes about 80% of the cost of health care and the employee about 20%. That's a very attractive plan, and it's a plan we want to protect long term. Please remember, I've provided you a reference for each of the template items. We've gone over this first page, and on the back of this page is information related to biometric screening, either through your primary care doctor or through LabCorp, and also a 6-month health coach consultation that we would like you to participate in. There is also information on the tobacco affidavit process, obtaining a physical examination by your primary care physician during the program year, and then for the ladies, completing mammography and pap screening, and for the guys, prostate-specific antigen or PSA testing. Please refer to that reference if you have any questions related to the program, or, again, you can call Ashley. Biometric screening is the first template component. You need to complete testing of total cholesterol, HDL, LDL, triglycerides, blood sugar, body mass index, which is BMI, and blood pressure. Note that the templated item says biometric screening and consultation because you will be going to your primary care doctor or to LabCorp. You don't need to worry about the consultation component. We just need the lab results to be entered into the website. Now, if you go to your primary care doctor, you'll be able to get all this information. And remember, the deadline for this is February 28th. Again, this should be a preventative exam, both in terms of the physician's evaluation and the lab work, and there is no cost to you. That's new in your plan this year. If you go to LabCorp, we also need a BMI and blood pressure, and we can have you submit that on the honor system, basically height and weight, and go to a drugstore or an emergency department or stop by your physician's office to get your blood pressure. That will complete the biometric screening component. Regarding biometric screening, if you choose to go to LabCorp, you must first complete the LabCorp form and fax it to IWS. This form was previously presented. Once you fax that form to IWS, we'll be back in touch with you regarding the LabCorp process. Notice that this template item says biometric screening and consultation. The consultation component is waived for those that are listening to this webinar. You just need to complete the biometric screening and enter your data into the website prior to February 28th. The next item is health risk assessment. We talked about that briefly already. This is through the Anthem website. You will need your personal Anthem identification number and also the group number that we previously provided. This is about a 25-minute survey tool where you answer questions like, what are your dietary habits, what are your sleep habits, do you wear a seatbelt, etc. And then it will provide you feedback in a confidential manner related to your risk and possible interventions. The next item is signing of the tobacco affidavit. If you don't smoke or use smokeless tobacco or e-cigarettes, based on the honor system application that we're using, you can sign that affidavit. However, if you can't sign that affidavit, you can take IWS's 6-week tobacco cessation course with weekly health coach consultation, and if you complete that course, you will gain those 50 points whether or not you stop using nicotine or not. The next item is a 6-month screening. That, of course, will be a phone consultation for those that are listening to this webinar. Sometime between May 1st, 2015 and August 30th next year, we would like you to contact Ashley. She'll review your biometric screening information with you, talk to you about your progress in the program, and make sure you're guided towards successful program completion. The last several items have to do with preventative exams. The first of those items is an annual physical examination by your physician, nurse practitioner, physician assistant. Ladies, if you work with an OB-GYN, that's fine. When you call and make the appointment for an annual preventative exam, you want to make it clear to the office staff and to the physician that you're there for an annual preventative exam. There is no cost after healthcare reform for an annual preventative exam. This is true of all the examinations that are listed on this slide. So call and make the appointment as a preventative exam and make sure the doctor in the office code it in that manner. Use a billing code as a preventative exam, and there'll be no cost, no deductible, no copay. You're allowed one of these examinations each calendar year. So if you had one in the last month or so and you want to provide that to us, then we'll go ahead and credit you with that. If it was earlier in the year, you're going to have to wait till early next year during the health care plan year, which is a calendar year, to go ahead and get that and then submit it to us. Regarding male examinations, we're going to ask males over the age of 50 to obtain a prostate-specific antigen test. This is the blood test. If you're younger than 50, you get these points automatically. Some physicians are changing their thinking on PSAs. It used to be males over 50 needed one every year. Now, some physicians believe that one only needs to be done every 2 or 3 years. Whatever you decide with your physician, then that is fine. Give us that information. And for the ladies, you need a pap smear, generally between the ages of 18 and 65. This also used to be every year, but many clinicians now believe it only needs to be done every 2 or 3 years. Some clinicians still do them every year. So whatever your provider recommends is fine. Just give us that information. If you're outside those age ranges, you get those points automatically. And for women also, we would like you to get a mammogram if you're 40 years of age or older, according to your physician recommendation. If you're 40 or younger, you get those points automatically. If your physician does not feel that you need this examination this year, that's fine. Give us those points. Remember, you need to submit confirmation of these examinations with the physician fax form. There are areas on the fax form for each of these, and there's also an area on the fax form to indicate that the clinician doesn't feel that examination needs to be done during this program period. Either way is fine. Just give us that information and we'll go ahead and credit you with the points in those categories. All right, as we head down the home stretch here, remember there are 2 incentive periods. We've talked about these before. Now that we've reviewed the template, you understand what you need to do in each incentive period. Let's talk for a moment about program confidentiality. I want to assure you about program confidentiality. IWS is subject to the HIPAA regulations. Those are the private information regulations. When you go to a doctor's office, you have to go ahead and sign a form indicating you understand that confidentiality. We will do the same thing. We are going to provide just very limited information to your company's leadership and management. That specific information is 4 items. We will provide whether you participated in biometric screening, yes or no, not the content of biometric screening, just whether you participate. Did you complete the health risk assessment? Yes or no. Not the content of it, just yes or no. What was the result of your tobacco affidavit? And how many points did you accumulate? Did you complete the program successfully so we can apply the incentive? All the remainder of your personally identifiable information will be contained within IWS. This is one of the advantages of having a vendor like IWS manage these programs. The information is not going through your human resources department. Now, we will share aggregate information with leadership and management. Examples of that would be, what's the percentage of people within the organization that have high blood pressure? How many people participated in coaching classes? What is the average cholesterol level within the organization? This allows us to tailor the program in future years to focus in on the specific risks of the organization. None of this aggregate data will be employee specific. Only those 4 items: participation in biometric screening, completion of health risk assessment, results of the tobacco affidavit, and how many points you accumulate will be the only items that are shared with leadership and management. So thank you for your time and attention over the course of the last half hours. In conclusion, we had 2 goals of this discussion, and that was to explain the incentives and explain what you need to do to obtain the incentives. Hopefully we have done that. If you think about it, what are we asking you? We aren't asking you to run a marathon. We aren't asking you to lose a bunch of weight. We're really just asking you to do what I believe you should be doing for yourself and your family members and your coworkers to help protect the health insurance plan. You have an expanded benefit package this year. Please take advantage of it. And also, please help protect the health insurance plan. You have a very attractive plan, and because you have very strong health insurance, you have access to the best medical care in the world. Because we live in America and we have access, we have the availability of the best healthcare services that are available. So, in that sense, the company has your back. I'm asking you now to have the company's back in helping to protect the health insurance plan so this strong insurance continues to be there for you and your coworkers and your family members indefinitely into the future. Thank you.